Welcome to P Academics. You are watching Dental Strings. Please follow us on Instagram for more handwritten notes. Today we are going to discuss development of occlusion. Development of occlusion is a genetically and environmentally conditioned process which shows a great deal of individual variation. The term occlusion is derived from Latin word occlusio, defined as the relationship between all the components of masticator system in normal function, dysfunction, parafunction. We are going to discuss four period: the predentate jaw relationship, the deciduous period, the mixed period, and the permanent dentition period. Let's start with the predentate period. This is the period soon after birth. During this, the neonate has no teeth, but the relation of gum pads is of equal importance. The alveolar process of the time of birth is known as gum pads. They are horseshoe-shaped pads that are pink, firm, and covered with a dense layer of periosteum. They are divided into two parts: labiolingual, labiobuccal, and lingual by dental groove. The gum pad is further divided into 10 segments by transverse groove. Each segment has one developing tooth sac. These relation of transverse groove is important in determining the permanent tooth relationship, which we will discuss later on. A very important landmark in gum pads is the lateral sulcus, which is present. The lateral sulcus is the transverse groove between canine and the first molar. This is helpful in predicting the inter-arch relationship at very early age. Complete overjet is present and infantile open bite is present. These infantile open bite is because this helps in normal development, and it is helpful during sucking. Now let's start with the deciduous dentition period. The initiation of primary teeth occurs during first 6 weeks of intrauterine life, and the first primary tooth erupts at the age of 6 months. In these, we are going to discuss few factors like spacing, terminal planes, anterior teeth relationship. Then we are going to discuss about the canine relationship, arch dimensions. To begin with, we'll start with spacing. It is supposed to be good, as spaces in between teeth can be utilized for adjustment of permanent successors, which is always in size of compared to deciduous teeth. Let's discuss primate spaces, which are also known as anthropoid spaces and simian spaces. The other one is a physiologic space. It is between the maxillary lateral incisors and the canine, present mesial to maxillary deciduous canine, and mandibular canine and first deciduous molar. This is present to distal to mandibular deciduous canine. As you can see in the picture, that the space is present between the maxillary lateral incisor and canine, which is mesial to maxillary deciduous canine, and in mandibular it is present distal to mandibular deciduous canine. These spaces are also called as anthropoid and simian spaces, as discussed below, as they were initially found in our ancestral simian species. Now, present in the physiologic spaces are present in between all the primary teeth and plays an important role in normal development of permanent dentition. In maxillary, it is usually 8 mm, average 4 mm, and in mandibular, it is usually 7 mm with an average of 3 mm in mandibular arch. As you can see in the picture, these are the primary dentition, and these are having physiologic spaces, but this will be used by permanent dentition as the tooth size is larger. Now, also, what if there is no space? It does happen, and this is known as the non-space dentition. A non-space dentition is highlighted by the lack of space between primary teeth, either due to small jaw or larger teeth. These type of dentition usually indicates crowding in developing permanent dentition. So one should recommend or go to dentist if they are on a regular basis to avoid such kind of complication in the permanent dentition. The picture shows there is no physiologic spaces in the given primary dentition, and these will lead to crowding while permanent erupts. Now, let's discuss the terminal plane. The mesiodistal relationship between the distal surfaces of maxillary and mandibular deciduous molars is called as terminal planes. There are three types of terminal planes, namely, the first one is flush terminal plane, the second one is the mesial step terminal plane, and the third one is distal step terminal plane. Let's discuss about the flush terminal plane. The distal surfaces of deciduous second maxillary and mandibular molar are in straight plane, that is flush, and therefore situated on the same vertical plane. This usually develops into class 1 and 74%. The mesial step is distal surface of the second mandibular molar is more mesial to that of second deciduous molar and will usually go into class 1 relationship, and only 14% of these is seen. Now let's discuss the distal step terminal plane. The distal surface of the deciduous second molar is more distal to that of deciduous second maxillary molar. The relationship is unfavorable as guides into distal occlusion, seen in 10%. Now, in the given figure, if you see, the first one is the distal step, which on normal growth or the minimal growth differential moves into class 2, but on further growth it is an end-to-end relationship. In flush terminal plane, it usually goes in end-to-end and class 1, and in mesial step relationship it is usually class 1, but on further growth it turns to class 3 relationship. Now let's discuss the third one, which is of great importance in anterior aesthetics. That is the anterior teeth relationship. Now anterior teeth relationship have three things which is to be noticed, that is overbite, overjet and edge to edge. Now discussing what is overbite, it is usually 2 mm, edge to is 0 bite and the overjet is 1 mm. Let's discuss the definition of what it is. An overbite, it is the distance which the incisal edge of the maxillary incisors overlaps vertically past the incisal edge of the mandibular incisors. And what is overjet? It is the horizontal distance between the lingual aspect of maxillary incisors and the labial aspect of the mandibular incisors when teeth are in the centric occlusion, as we can see in the picture. And edge to edge is when the incisal edge of two incisors are in the same plane. This is also called as zero overbite. Now let's move further and discuss about the arch dimensions, and they were first given by S. Zygmundi in 1890. We'll discuss about the arch size, arch length, arch circumference, arch width. As we can see in the picture, we can see arch size. It is the size of primary dental arch, is the arch width between the primary canine and the second molar. Arch length is measured from the most labial surface of primary central incisor to canine and to second primary molar. Arch circumference is the length of curved line passing over the incisal edges and buccal cusp of the teeth from distal to the mesial surface of one molar to other, and arch width is bicanine and bimolar. Now let's discuss the canine relationship. The relationship of maxillary and mandibular deciduous canine was of the most stable in primary dentition. Let's discuss class 2, class 1 and class 3. As you can see in the picture, canine 1 relationship, it means the mesial inclination of the cusp of the upper canine which overlaps the distal incline of the cusp of lower canine. Class 2 is distal incline of the upper cusp of upper canine overlaps the mesial incline of the cusp of lower canine. And the third one is forwardly placed compared to upper canine, hence there is no relationship between the upper and the lower canine that exists and is referred to as class 3 canine relationship. Now let's discuss the mixed dentition period, the period during which both the primary and permanent incisors are present in mouth together and is known as mixed dentition. There are three periods in this: the first transitional period, the intertransitional period and the second transitional period. To begin with, we'll discuss the first transitional period. This is characterized by the emergence of first permanent molars and the exchange of deciduous incisors with permanent incisors. Starting with the anterior posterior relationship between the tooth opposing first molar after eruption depends on the position previously occupied within the jaws. The relation between maxilla and mandible is like cone and funnel mechanism. The cone is in the maxilla and the funnel is in the occlusal pores of the mandible. The terminal plane decides the position of mandibular molar which erupts at 6 years of age. Now, going to the second deciduous molar when they are in flush terminal plane. What happens to the eruption of the permanent molars? When second deciduous molar in flush terminal planes, the permanent molars are in the same relationship. What does that mean? That the permanent molar will erupt in the class 1. To occur this, like what have the permanent molars to do if they have to change in class 1? Molar have to move 2 to 3 mm forward. It can be done by early mesial shift and the other one is late mesial shift. Early mesial shift utilizes the primate spaces as we discussed earlier, which are also known as Siemens spaces, and it is class 1, and the late mesial shift utilizes the leeway space and it gets the class 1. Now, let's discuss what happens when the second deciduous molar are in mesial step terminal plane. The mesial step, as you can remember, the distal mandibular deciduous teeth is the more mesial relation to the maxilla. Now, it directly erupts in class 1, but if occurs increased growth or there is more utilization of the space, it results in class 3. Now, let's discuss the third criteria in which the second deciduous molar which is there is in the distal step terminal plane. As you remember, the distal step is the mandibular, deciduous distal side of the mandibular molar is more distal to the maxillary, which will grow in class 3, and if growth occurs more, it is an end-to-end relationship. The second thing is extension of incisors. Deciduous incisors are changed by permanent incisors, and obviously the size of the permanent incisors is greater than the deciduous, and this is usually between 6.5 to 8.5 years of age. Now, as there is larger in size, there is more space uses, and this is known as the incisor liability. In maxillary, it is usually 7 mm, and in mandibular, it is usually 5 mm. Now, there are few factors which that helps in alignment of the incisors in the oral cavity when there is a exchange of dentition from permanent from deciduous to permanent. There are usually 4 of them. The first one is the utilization of interdental space, which is 4 mm in maxillary and 3 mm in mandibular. The second one is increased intercanine width, where the permanent teeth can adjust themselves, and the third one is increased intercanine length, and the fourth one is change in interincisal angulation. As you see, there is 150-degree angulation in the deciduous and it changes to 120-degree in the permanent dentition. Now, the second period of the mixed dentition is the intertransitional period, and these intertransitional period is the one where there is a mixture of both maxillary and the mandibular teeth, the permanent teeth and the deciduous. There is permanent incisors and molars and deciduous canine and molars. Thank you.